Welcome to the Nociscan Training video. This video will walk you through the process of performing a Nociscan exam for chronic low back pain. Nociscan is the first software platform backed by clinical evidence that helps physicians non-invasively identify which lumbar discs are causing pain. Using MR spectroscopy and augmented intelligence, Nociscan analyzes biomarkers, or chemical signals, in the spinal discs. When specific biomarkers appear in certain ratios, they indicate a painful disc. Nociscan quantifies these biomarkers and transforms the complex data into actionable insights, helping surgeons make more informed treatment decisions for patients with chronic low back pain. The MR spectroscopy scan used by Nociscan can be performed in a conventional MR scanner. Nociscan provides an objective analysis of pain biomarkers individualized to each patient. In conjunction with other diagnostic tools, Nociscan delivers critical insights into the source of a patient's low back pain to help physicians optimize treatment plans. Position the patient in the MR scanner as you would when examining a lumbar spine. Use a wedge pillow to help stabilize the patient if needed. The laser should be marked about 1 inch above the patient's iliac crest or hip bone. Once the patient has been positioned, register the patient. Be sure to enter the name of the referring physician and the operator's initials. The patient may be registered either head first or feet first. If the patient is claustrophobic, apply a small towel over the patient's eyes. We'll now walk through the steps to complete a Nociscan, including image acquisition, setting up the voxel, running the examination, submitting the images, and completing a Nociscan. There are 3 sequences at the beginning of the exam that need to be run one time to initially configure: 3-plane localizer, table position strategy, and T2 weighted sagittal. The T2 weighted sequence generates the reference images and are not used for voxel planning. Now we're ready to begin the first sequence, which is a 3-plane localizer. Press Go to continue. The table position strategy sequence uses a first localizer sagittal image to select the position mode. Select local range and then drag the yellow bar and position it over the L3-L4 disc, then press Go to continue. The next sequence is the T2 weighted sagittal. The center slice of this sequence is used in the report to provide anatomical reference only. You have now completed the required steps to draw a voxel. Before you start drawing a voxel, locate the lumbar disc prescription from the referring physician. A minimum of 3 discs is preferred for generating the report. Remove sequences for discs that are not prescribed by the physician. If discs have not been prescribed, then start with the L5S1 disc and continue to the next disc above until you have acquired 3 discs. Observe the sagittal localizer center slice to qualify a disc. A disc may be disqualified if it is less than 4 millimeters in disc height. Delete the entire sequence for that disc to disqualify it and proceed to the next disc. Voxel prescription images in the sagittal and coronal planes are required to draw a voxel and the adjust volume. The voxel prescription for the L5S1 disc starts by positioning the sagittal localizer, which will always be centered on the L3-L4 disc. Start the sequence. The next sequence is the coronal localizer L5S1, which should be centered in the L5S1 disc and perpendicular to the lower vertebral end plate. Run the sequence. At the end of the sequence, a scan assistant prompt will be displayed. Press Manual. A white region of interest or ROI icon will be displayed. drag the icon over the L5S1 disc in the sagittal view and pin it in the center of the disc. The ROI icon will become a red circle in both the coronal and sagittal images, and the convert images in the lower left corner of the dialog window will become active. Press the button and wait several seconds while the images are being processed. The red circles will be replaced by yellow voxels to indicate that we are ready to go. Start the voxel plan by centering the voxel in the middle of the disc in the coronal plane. Place the cursor on the voxel and press right-click perpendicular. The voxel should appear as a 2D rectangle. Position the voxel over the lower vertebral end plate and provide a gap or daylight under the door between the voxel and the lower vertebral end plate. In the sagittal plane, fly through all the slices and observe that the voxel changes from solid to dashed lines. If the voxel has solid lines and is touching either the upper or lower end plate, then reposition the voxel to avoid contact. This is because if the voxel touches the end plate, it may cause lipid contamination. If the voxel is appearing as dashed lines, then there is no need to move it. The default voxel dimensions are 3 mm head-foot, 20 mm anterior-posterior, 20 mm left-right. In the coronal plane, if there's a clear lower end plate voxel gap and at least a 2 mm margin between the voxel and upper end plate, increase the voxel HF dimensions from 3 mm to 4 mm. If the disc is less than 4 mm, then reduce the voxel LR and AP dimensions to 18 mm. Note that increasing the voxel volume improves the acquisition quality. Position the green Adjust Volume box so that it straddles the disc and contains the voxel. Do not change the Adjust Volume dimensions. With the voxel and Adjust Volume images present, select the coronal plane and select Create Snapshot in the drop-down window. This will capture the voxel image in the coronal plane used for the acquisition. Repeat for the sagittal plane. Press Go to start the SVS sequence. The SVS sequence starts with an automated shimming process to improve the quality of the acquisition. At the end of the shim, the Confirm Frequency Adjustment window will appear. In the window, look for the full width half max FWHM HZ value displayed in the upper right. If the value exceeds the limit for the scanner, then increase the HF dimension by 2 mm and repeat the shim. If the limit is exceeded the second time, then just continue with the acquisition. Press the Apply button to start the SVS data acquisition. The SVS sequence will last about 5 minutes. After a few seconds, the inline view window will open and display the spectral aggregate or average of the unsuppressed water spectra. Observe the region downfield to the right. It should be very flat. If there is lipid, a bump will be present immediately. Stop the acquisition, copy it, and display the voxel and Adjust Volume boxes. There are 3 steps to reduce end plate lipid detection. Make sure that there is a gap in all coronal and sagittal slices between a solid voxel and the upper and lower vertebral end plates. Reduce the AP and LR dimensions to 18 mm. Adjust the voxel angle in the sagittal plane. Do not touch the Adjust Volume box. Changing the Adjust Volume will force a new shim. If lipid is detected, or a bump is still present after the second attempt, continue with the acquisition. During the SVS acquisition, you can plan the next sagittal localizer. Be sure to upload the images as trained by your field engineer within 24 hours. The Nociscan exam is now complete. When ready, the report will be available in the physician portal.